the congenital cardiac diseases in dogs and cats. For the overview, the key diseases are aortic stenosis, pulmonic stenosis, patent ductus arteriosus, ventricular septal defect, and mitral valve dysplasia and teratory of Fallot. The signs are sudden death, cyanosis, and a murmur, grade 3 to 6, and exercise intolerance. For the compensation mechanisms, for pressure overload in aortic stenosis and pulmonic stenosis, we can see concentric hypertrophy. For volume overload in patent ductus arteriosus and ventral septal defect and valve dysplasia, we can see eccentric hypertrophy. In aortic stenosis, the signs are a weak pulse and left ventricle hypertrophy. For the murmur, we can see a crescendo-decrescendo systolic, and the treatment is beta blockers and balloon dilation. In pulmonic stenosis, the signs are ascites, jugular distension, and right ventricle hypertrophy. The murmur is an ejection systolic with a thrill, and the treatment is balloon valvuloplasty and beta blockers. In patent ductus arteriosus, the signs is a continuous machinery murmur and a bounding pulse. The treatment is a surgical ligation or a transcatheter closure. In ventricular septal defect, the signs are congestive heart failure and large defects and holosystolic murmurs, and the treatment is a bypass surgery. In mitral and tricuspal dysplasia, the signs are volume overload and eccentric hypertrophy, and the treatment is valvuloplasty. In tetralogy of the Fallot, the components are pulmonic stenosis, ventral septal defect, overwriting aorta, and right ventricle hypertrophy. Other conditions are persistent right aortic arch, which causes esophageal compression and megaesophagus, and atrial septal defect, which leads to a left to right shunting, and peritone-pericardial diaphragmatic hernia.